Assalamualaikum warahmatullahi wabarakatuh. Today our group will present about effects of high and low fat dairy food on cardio-metabolic risk factors. Prepared by me, HANIS IZZATI binti HUZAINI, NURULSARINA, Qahirah binti JAMALUDIN, FARAH INSYIRAH, SYAZWANI, and NURUL NAJIHAH.
Hi, my name is INSYIRAH binti RAHMAN, and I'm going to present about abstract in this journal. So we start with the importance in this journal is the clear guidelines on the health effects of dairy food are important given the high prevalence of obesity, cardiovascular disease, and diabetes, also increasing global consumption of dairy food. So the objective is to evaluate the effects of increased dairy food on cardiometabolic risk factors. And the data source is the researches were performed until April 2013 using Medline, ScienceDirect, Google, Embase, the Cochrane Central Register of Controlled Trials, reference list of articles and proceedings of major meetings. And the study selection is randomized control studies with healthy adults and randomized to increase dairy food for more than 1 month without additional interventions. Data extraction and synthesis. A standard list was used to extract descriptive, methodological, and key variables from all eligible studies. If data was not included in the published report, corresponding authors were contacted. Next is the results. So the result that we got from these studies is there was an increase in weight with low and whole fat dairy food, but no significant change in waist circumference, HOMA-IR, fasting glucose, LDL, HDL, systolic BP, diastolic BP, or CRP. Changes in other cardiometabolic risk factors were similar for low and whole fat dairy interventions. And the limitations in this study is most clinical trials were small and of modest quality. And the conclusion is increasing whole fat and low fat dairy food consumption increases weight but has minor effects on other cardiometabolic risk factors.
This problem have 2 points we can identify. First point is to identify the clear guideline on health effect of dairy food. We can find many disregards by promoting low-fat dairy as a healthy food. And the second one is to determine about good and suitable food for children and adults. We also can watch the program on health food to get information about it.
There are 4 main objectives on this journal. First, to evaluate the effect of increased dairy food on cardiometabolic risk factor, to learn about cardiometabolics, to distinguish between high and low fat dairy food, to know the importance to have a clear guideline of dairy food.
Now I present a limitation of study. So the first thing is the research present here was limited by the majority of subjects included in the meta-analysis were women, but there is currently no evidence for a different effect of diet by gender. Second is research in healthy people also eliminate the possibility of treatment or disease-related effect on the result of interest. More study is needed to demonstrate that dairy has similar nature effect in patients with diabetes and cardiovascular disease. And third one is the majority of the studies included were small, so this meta-analysis divide research into low-fat and whole-fat intervention. However, a direct comparison of this study may not be valid, as there have been no trials that directly compare low and whole-fat dairy diets, and the study can rule out a slight increase in LDL cholesterol as a result of increased whole-fat dairy consumption. And studies are also need to assess the effect of other dairy dietary components.
In this journal, I found around 4 research questions and issues that we discussed by creator. First, what occurs of cardiometabolic? Second, what are effects of increased dairy food on cardiometabolic risk factor? Third, what is different between high and low fat dairy food? And lastly, is it important to have a clear guideline of dairy?
Next, I will present about a significance of this study. So first, our finding from this research work is expected to be relevant and useful to students, teachers, researchers, publishers or mass media. And second, in these observational studies, dairy food consumption was linked to a healthy eating pattern and better cardiometabolic profile. And third one is, in observational studies, people who consume the most dairy had lower insulin resistance, and this link is stronger in people who are overweight or obese. And based on this observation, it is uncertain whether increasing dairy food improves insulin sensitivity. And a recent review by the American Diabetes Association conclude that none of the components of dairy appear to have an effect on glycemic control. Next, when whole fat dairy consumption was increased, LDL cholesterol did not alter appreciably in the current study. And this study reveals that LDL cholesterol effects may not be the fundamental cause. Then, in the DASH study, the intervention include increased low-fat dairy food, reduced total and saturated fat, and increased fruit and vegetable. And lastly, in a secondary analysis, it was estimated that low-fat dairy could account for about half of the observed 5.5 mm of mercury decrease in systolic blood pressure.
There are 8 conceptual frameworks that we can identify from the journal effect of high and low-fat dairy food on cardiometabolic risk factor are as follows. First, finding suitable methods to be used as a guide in making the analysis, form, implementation, and reporting of this meta-analysis. After we complete the first point, we need to create a protocol for the study, such as guideline throughout the design, implementation, analysis, and reporting of this meta-analysis. Found several trials that show increased milk for at least a month without additional intervention. For caloric restriction, multi-dietary intervention had an appropriate control group and sufficient data to calculate estimate of effect with standard deviation on at least one of the following week. Found several trials that show increasing milk for at least a month without additional intervention. For caloric restriction, multiplier dietary intervention had an appropriate control group and sufficient data to calculate estimates of effect with standard deviation on at least one of the following week with circumference and blood pressure. Requires a reviewer to screen all abstract, title, and after obtaining candidate review, 2 team members JB and KS review the complete text to determine eligibility. If the study qualities, the data will be interacted by JB. Next, calculate the effect estimate with standard deviation on at least one of the following: body weight with blood pressure, HDL and LDL, cholesterol, fasting glucose, insulin, and C-reactive protein. Measuring insulin. Found several trials that show increasing milk for at least a month without additional intervention. For caloric restriction, multiple dietary intervention had an appropriate control group and sufficient data to calculate estimate of effect with standard deviation on at least one of the following: weight, and blood pressure. Second one is requires a reviewer to screen all abstract, title, and after obtaining candidate review, two team members JB and KS review the complete text to determine eligibility. If the study quality, the data will be extracted by JB. Calculate the effect estimate with standard deviation on at least one of the following: body weight, blood pressure, HDL and LDL cholesterol, fasting glucose, insulin resistant, and C-reactive protein. Measuring cylinder resistance is a homeostatic model assessment. Insulin resistant HOMO-IR. This estimates the insulin sensitivity of a fixed state as a unit. The equation used is HOMO-IR equal glucose m mole per L, insulin m unit per L divides 2020.5. Found several trials that show increasing milk for at least a month without additional intervention. For calorie restriction, multiple dietary intervention had an appropriate control group and sufficient data to calculate estimate of effect with standard deviation on at least one of the following: weight, and blood pressure. Requires a reviewer to screen all abstract, title, and after obtaining candidate review, two team members JB and KS review the complete text to determine eligibility. If the study qualifies, the data will be extracted by JB. Calculate the effect estimate with standard deviation on at least one of the following: body weight, blood pressure, HDL and LDL cholesterol, fasting glucose, insulin resistant, and C-reactive protein. Measuring cylinder resistance is a homeostatic model assessment. Insulin resistant HOMO-IR this estimates the insulin sensitivity of a fixed state as a unit. Difference in mean meal intake between groups is 3.12 standard serving size per day. In the study, there was no imbalance between the randomized group. One crossover study had a higher dropout rate for subjects initially crammed to low compared to high meat intake, 49% versus 22%.
For the organization of literature review, for the introduction, dairy food with less 1% fat, such as cream or low-fat milk, was categorized as a low-fat dairy food. Dairy food that includes full-fat milk, 3 until 4% fat, such as cheese, butter, cream, and ice creams, was categorized as whole-fat dairy food. Whole-fat dairy foods contain many fatty acids, which may have favorable as well as unfavorable effects on lipids and other cardiometabolic risk factors. The literature review examines the effects of high and low fat dairy food on cardiometabolic risk factors. Effects reducing saturated fat from one food are determined by other dietary change, including carbohydrates, monounsaturated and polyunsaturated fatty acid. There are many studies of effects of whole-fat dairy food. However, since the focus of this research is on feeding and dietary, they will not be reviewed in detail and will only be referred to as appropriate. As we can see, the effects of increased dairy food on cardiometabolic risk factors are raising blood lipids, increasing serum total and LDL cholesterol. These are evidence from other journals and articles. It is, however, becoming clearer that differences exist between dairy food in their ability to raise blood lipids from nerve growth and given in 2016. There is consistent evidence that consumption of dietary SFA increases serum total and LDL cholesterol concentration, a robust indicator of coronary heart disease (CHD) risk by William and Buttrice in 2006. Dietary patterns characterized by increased dairy consumption have a strong inverse association with insulin resistance syndrome (IRS) among overweight adults and may reduce risk of type of 2 diabetes and cardiovascular disease by Qahirah and other journalists in 2002. And the second one is there are many causes of cardiometabolic by eating high and low fat or low dairy foods. Randomized control trial RCT of disease for cardiometabolic effects saturated fatty acid SFA consumption in humans, including whether effects vary depending on specific SFA change, length, under replacement nutrient, or a disease severity by Renata and Mozaffarian in 2010. Since it has been shown that cheese is the richest source of long-chain monoquins vitamin K2 in the Western diet by Sugars and Vimia in 2001. Adherence to dietary quality indices also have shown to have potential favorable effects on obesity related with health outcomes by Qahirah and other journalists in 2020. And the last one is differences between high and low fat dairy food. Low fat was good while high fat was bad by Lisa and Ellison in 2019. In fact, some recent studies have even suggested that full-fat high dairy may keep you thinner and that there is a correlation between consuming low-fat dairy and being overweight by Lisa and Ellison in 2019. The major differences between low-fat and full-fat dairy are largely kilojoules and fat content by Lisa and Ellison in 2019. And for the conclusion, dairy products reported a better diet quality and particularly cheese. For the example, consumers presented a lower prevalence of hypertriglyceridemia and lower HDL cholesterol plasma levels, which are components. The three main areas is effects of increased dairy food on cardiometabolic risk factors, the causes of cardiometabolic and difference between high and low fat dairy food. Increase in both whole and low fat dairy food without other dietary intervention is associated with a modest weight gain with no or minor effects, another cardiometabolic risk factor. Increase in both whole and low-fat dairy food without other dietary intervention. These observations suggest that for most health individuals, it is reasonable to include both low and whole-fat dairy as a part of a health. These are the references that I use for the organization of literature review.
The research methodology in this journal is, this journal followed the PRISMA guidelines throughout the design, implementation, analysis, and reporting of this meta-analysis. And point number 2, a protocol for the study was designed and available as file as to. Point number 3, the study was registered with the Australian-New Zealand Clinical Trials Registry with trial registration number.
So, from this journal, I can identify that the method that used to obtain data collection procedure is through quantitative data collection. It is because in this journal, the research review 20 study with 1,677 participants with a median duration of dietary change of 26 weeks and mean increase in dietary food intake of 3.6 served per day were included by use observation method.
This data is data analysis procedure, which is 5,504 articles identified and duplicate in 1,844, and only 3,660 articles and studies excluded after review of title and sub-abstract is only 3,435. Every three for detailed analysis is 225. And studies not meeting inclusion criteria is not random or not randomized control trial 448. Caloric restriction 68, includes multiplied dietary intervention 66, dairy food intervention is 13, intervention lower than 4 weeks is 5, participant age less than 18 years is 5, non-healthy adults, hypertension, cardiovascular disease, and diabetes is only 16, and not English is 4, and we get included in meta-analysis is 20. And for the summary of major findings, the findings of the studies were summarized according to the statement of the problem stated in objective. For all studies, there was no significant change in either systolic blood pressure or diastolic blood pressure. There was also no evidence for effects on blood pressure when studies were stratified by duration of dietary intervention, height and low fat dairy, and normal or overweight subjects. And these are the evidence for the summarizing.
I will present about the organization of report. Introduction. Clear guidelines on the health effects of dairy food are important given the high and increasing prevalence of obesity, cardiovascular disease, and diabetes in most countries, and the increasing global consumption of dairy food. Increased dairy consumption is associated with lower blood pressure, weight reduction, improved insulin sensitivity, less inflammation, and lower ratio of total to HDL cholesterol. Whole fat dairy is not recommended in most food guidelines because of the concern that saturated fat dairy food may have an adverse effect on serum lipids, which could increase the risk of cardiovascular disease. Whole fat dairy foods contain many fatty acids, which may have favorable as well as unfavorable effect on lipids and other cardiometabolic risk factors. Method. Search strategy. Search for all trials that randomize adults to increase dairy for at least 1 month without additional interventions, such as calorie restriction, multiple dietary interventions, had an appropriate control group, and sufficient data to calculate estimate of effect with standard deviations on at least one of the following, such as weight, waist circumference, blood pressure, HDL and LDL cholesterol, fasting glucose, insulin resistant, and C-reactive protein. Assessment of study eligibility and data extraction. One reviewer screened all abstract and titles, and upon retrieval of candidate studies, two team members, JBKS, reviewed the full text to determine eligibility. Definitions. Used to quantify insulin resistance was the homeostatic model assessments such as insulin resistance. And the last one, statistical analysis. Each cardiometabolic risk factor when on a higher and lower dairy diet was compared between cases and control from the same study. Result. Search result. The literature search yielded 5,504 citation, of which included 1,844 duplicates. After title and abstract screening, the full text of 255 articles were evaluated, with 205 excluded either because the intervention included calorie restriction or had multiple dietary changes, or the study was in a population with disease. Characteristic of study. Characteristic of the 20 included trial, which included 1,677 participants, are summarized. The average age was 51 years and 78% of participants were female. The median duration of follow-up was 26 weeks. The average difference in dairy intake between groups was 3.12 standard serving size per day. One crossover study had a high dropout rate for subjects initially randomized to low compared to high dairy intake. Effects on body weight. Studies reported effect on weight in 1,629 individuals. The mean body mass index (BMI) at baseline was 25.6 kg and weight 77.7 kg. Effect on insulin resistance. There was no significant change in fasting glucose on higher compared to lower dairy diet. Assess effect on HOMA-IR in 270 subjects. Effect on LDL and HDL cholesterol. There was no significant change in either LDL or HDL cholesterol after increasing dairy food. Effects on HDL cholesterol were consistent across studies, but there was heterogeneity for LDL cholesterol. There was no change in LDL cholesterol when whole-fat dairy or low-fat dairy food was increased. Results were similar for shorter and longer periods of dietary intervention and for studies which included normal and overweight or obese participants. Effect on C-reactive protein. There was no significant change in C-reactive protein on a high dairy diet. Significant reductions in C-reactive protein with increased dairy intake. There was no evidence for effects on C-reactive protein when studies were stratified by duration of dietary intervention, high and low fat dairy, or normal or overweight subject. Effect on blood pressure. There was no significant change in either systolic blood pressure or diastolic blood pressure. There was also no evidence for effect on blood pressure when studies were stratified by duration of dietary intervention, high and low fat dairy, or normal or overweight subject. And the last one, evaluation of heterogeneity and sensitivity analysis. Industry-sponsored studies were more likely to report favorable effects on risk factors than non-industry sponsored studies. Final plots identified that the study by Stancliffe reported decreases in LDL cholesterol, HOMA-IR, C-reactive protein, and waist circumference on the increased dairy diet beyond the 95% confidence range for all studies combined. This study also reported the greatest decrease in blood pressure and weight for all studies. Excluding these studies, in a sensitivity analysis, substantially decreased heterogeneity, but overall effect was similar, and there was no other consistent difference between smaller and larger studies. Discussion. This systematic analysis of randomized dietary intervention trials suggests that a moderate increase in dairy food consumption has no or small effects on the major cardiovascular and metabolic risk factors. Result from several large epidemiological studies which conclude that dairy food may have favorable effects on insulin resistance and decrease the risk of type 2 diabetes. In these observational studies, dairy food intake was associated with an overall healthier eating pattern, healthier lifestyle, higher socio-economic status, and educational attainment, which are each associated with more favorable cardiometabolic profiles. Evaluating effects of dairy in randomized intervention trials is likely to be more reliable than from observational studies where association may not be causal. Several observation studies have suggested that dairy food may facilitate weight loss, particularly in obese and overweight individuals. Randomized trials where the intervention included both increased dairy food and calorie restriction. Weight loss has been reported. In the current meta-analysis, which included studies which gave no advice on calorie restriction, increasing dairy food resulted in a modest weight gain. Similar in studies which included overweight and obese participants, which no direct comparison is possible. Mean weight gain on low-fat dairy food is double that of whole-fat dairy food. Conclusion: increase in both whole and low-fat dairy food without other dietary interventions is associated with a modest weight gain with no or minor effect on other cardiometabolic risk factors. These observations suggest that for most healthy individuals, it is reasonable to include both low and whole-fat dairy food as part of a healthy diet. That's all from us. Thank you.